when we're talking about the supplements,
Sure.
okay, of, what kind of supplements do you suggest? I know we've talked about omega and the B12 and things like that, but and I've learned too, obviously, just these last couple of years, there's a difference when you go and you buy a synthetic supplement versus a whole food supplement. And if there is a viewer watching who may be going through chemo, that it's important that they tell their oncologist certain supplements that they're taking, like a kava, for example,
Sure.
because that can have some effects while you're going through that. Am I off point here?
Well, I think supplements really need to be individualized. There is still a lot of concern about combining antioxidants with radiation because radiation works through creating these free radicals that the antioxidants and the vitamins would sort of scavenge. And so we are very concerned about with radiation. Many kinds of chemotherapy used in breast cancer also work through that mechanism, but not all. For example, the hormonal therapies don't work through that mechanism. And so it's really important to have that conversation either with your physician or with a pharmacist who really understands how the medicines are working and whether or not it's safe for you to be taking supplements at the time of treatment. When you're done with treatment, I'm not a very big supplement person. I think people should eat whole, healthy food, but sometimes it can be very beneficial. You mentioned kava. Kava is an herb that comes from the South Pacific. It's used to help reduce anxiety. There are other choices as well. Often people are very anxious as they're going through treatment. And there can be a great value, instead of having to add more pharmaceutical medicines, to be able to use some of these things. So, for example, I've taken kava during times of stress. There's one I really like. It's a tea. It's called Stress Relief. And it's a kava tea. And you brew it as a tea. You let the tea bag soak for 5 minutes, and then you drink it. It's very relaxing. It may help you sleep. So there are many things that can be used to help reduce the side effects that women may struggle with as they're being treated for breast cancer. It is a bit of an individual person-by-person set of decisions, as opposed to, well, everyone should be doing X.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.